Well, we're back right here in the studio, and our second guest, we have with us Dr. Mohammed Al-Banna, and Dr. Mohammed is a consultant cardiac surgeon at the Chest Disease Hospital. Dr. Mohammed, welcome to our program, Hala, Kuwait.
Thank you very much for having me, Tariq.
Nice to have you with us right here in the studio.
Pleasure.
I know September 29th was World Heart Day, and recently you had a celebration. I believe we were taking a look at that earlier. So what is the aim of celebrating World Heart Day on a yearly basis, Doctor?
Yes, so World Heart Day is an opportunity for us to talk about the risks of cardiovascular disease. It's an opportunity to remind people about the risk factors involved in developing heart disease, and hopefully it is a time when someone would take the leap, change their lifestyle in hopes of preventing heart disease. You might wonder why heart disease, what's so important about heart disease?
It's prevalent, right, Doctor?
It is the #1 killer in the world. It kills 17 million people per year. The other problem is that the risk factors for heart disease are on the rise.
Such as?
#1, hypertension, high blood pressure. At the moment, there's more than 1 billion people who have uncontrolled high blood pressure. That's not people with high blood pressure, no. It's people who take medicine and yet their blood pressure is not controlled. Diabetes is on the rise. In the past 10 years, diabetes has gone up by 50%. Lifestyle, 25% of the world's population does not move enough in their daily.
Yeah, we're always, Doctor, in the top 5 when it comes to prevalence of diabetes, obesity. Exactly. I think we were #1.
Exactly, and Kuwait it's a particular problem here, you know. Obesity is also a reflection of the lack of movement and exercise.
Sedentary lifestyle.
Exactly, exactly. Smoking, more than 1 billion people worldwide smoke. It's projected that by year 2030, deaths are going to go up to 23 million per year. So the problem is escalating, it's getting bigger. The sad part, do you know what the sad part?
What is it?
We can slash the deaths from heart disease by 75% by only taking small measures, you know,
such as?
Lifestyle measures that we all know about.
Give us some brief examples now, Doctor.
So brief examples would be exercise. I usually tell my patients, move 30 minutes a day, 5 days a week. Don't do more, because if you do more, you try and be greedy and you do more, then you'll be like, you know what? I don't have an hour to exercise. I'm going to skip exercise today. 1 day becomes 2 days, 2 days become 3 days, and then you've missed exercising for months. So stick to 30 minutes. That's all you need to do of walking. You don't need to do anything excessive. Just walk, brisk walking, not chill walking. Get your heart rate up a bit, and that should be enough. #2, whatever risk factors you have, diabetes, cholesterol, smoking, try and adjust your lifestyle. Eat healthy. I know it's very hard to say, you know, because Kuwait has many
abundance of all kinds of food, and restaurants. And
it is hard.
Fast food also.
Absolutely, absolutely. And now it's
and
just
tasty food too, Doctor.
Absolutely. It's only a button or a click away.
Yes.
But try and resist. Try and stick to healthy food and change your lifestyle. That on its own would reduce the risk of heart disease or dying from heart disease ginormously. So they are only small steps in theory, but they'd help you a lot with your cardiovascular
Well,
disease.
very good advice, which you know, a lot of your colleagues, and I think worldwide, a lot of the doctors talk about, but it's always good to hammer it more and more for the audience.
Absolutely. Smoking again. Smoking is another big risk factor. You know, people talk about, you know, I've tried quitting, I've tried patches, I've tried chewing gum, and it's not worked. There's a specific way to use the patches and the chewing gums. You have to go to a smoking cessation specialist. He or she would advise you on how to use the patches and as well as the chewing gum in order to quit smoking. It's not a haphazard way of quitting. No, you have to do it scientifically. See a specialist who's a smoking cessation specialist, he or she could help
And
you with that.
unfortunately here, doctor, not just the normal cigarettes, shisha is also a very popular pastime here. It's
absolutely.
Activity that people love.
You know what? I cannot recommend shisha. It's another way of smoking tobacco, and
it's not less harmful. They say it's water-based. Is that, or do you know anything about that, or that's not true?
These are just excuses that people make.
This is not true then.
This is not true at all. It is as dangerous, if not more. The amount of tobacco that you smoke in one sitting equals more than a pack of cigarette. So kidding yourself and saying, you know what, it's going through water, it's filtered, it's this and that. This is just a way for someone to kid themselves and continue a bad habit that they should stop immediately.
Very well said, Dr. Muhammad. And now tell us a little bit about your work. You're a specialist cardiac surgeon. What are some of the cases that you face right here in the state of Kuwait?
So just to clarify, you know, some people mix the heart surgeon and the cardiologist.
So what's the difference?
So the difference is heart surgeons do the open heart procedures. So it's a full-fledged operation. On the other hand, cardiologists are either the doctors who prescribe you the tablets, who do the ultrasound of your heart, or do the angiogram, which is sticking a wire down an artery and taking pictures of the arteries of the heart. So these are cardiologists, we are heart surgeons. Normally what we deal with on almost daily basis is coronary artery disease, blockages in the arteries that supply the heart. Because of the abundance or the prevalence of risk factors for coronary disease, as we said, smoking, diabetes, lack of exercise, poor dietary habits, we have a high prevalence of coronary artery disease. And these problems are either dealt with through coronary angiogram, putting a balloon, opening the balloon and putting a stent in. If these guys can't fix the problem, then they refer the patients to us, and that's when we get coronary bypasses. We basically take arteries or veins. Arteries can be taken from the inside of the chest wall, the arm. Veins are usually taken from the leg, and we use them to create bridges to bypass narrowings in the arteries. So that's what we do almost on a daily basis.
Is it dangerous surgeries?
So it is a big operation. I cannot say it's a small operation as other small operations. However, it's become a routine operation. In Kuwait, we do more than 1,000 operations per year. The results are very good, and patients seem to be very happy. So again, it's not small, but it's routine that we do every day.
Okay, very hectic schedule, and we appreciate you joining us right here on the program. I know you had the celebration, you have also the patients, everyone to see.
Absolutely. You know, but you know, the thing is, it's an opportunity to remind people.
Sure.
You know, this information has to be hammered into patients' heads.
Yes, I know.
In order to hopefully make them decide to change their lifestyle and avoid heart disease.
Yeah, that's what we hope, so that we always hope for the people that watch the program, whenever we have specialists in the various medical health fields, that
yes,
hopefully they makes an indentation with them and they change a little bit of their lifestyles, doctor. And what's some of the latest developments, new techniques that you could share with our audience, doctor, that maybe is being done at the Chest Disease Hospital right here in the state of Kuwait?
Okay. So, you know, the trend has, in medicine generally, and in surgery in particular, has been to reduce and shrink the wound size or the incision size. When I started in the field of cardiac surgery, you know, the incision was huge. So people would say it's from your neck all the way down to your belly button. It's an exaggeration, but that's what people felt it's like. So now the incisions are getting smaller and smaller and smaller. Some procedures could be done through an incision of 5 centimeters, which is about that big. So we went from this much to this much.
Okay.
The other thing is that for the most common operation that we do, which is coronary bypass surgery, we used to make a whole incision through the length of the whole leg. So it used to be from here all the way down. Now, what we started doing is we'd make an incision this big. We'd pass a camera in and get the vein out without the need of opening the operation.
Very less invasive.
Exactly, less invasive. What does that do? It helps the patients get out of bed and start moving sooner. So instead of taking a few days, now in a day or so, they're up and about, walking down the corridors in the hospital. So that helps a lot with the patient recovery. The other thing that it's done is that it's brought down the rate of infection. The legs is not the cleanest part of a person's body. But with a smaller incision, you could avoid getting wound infections, and also that helps with the speed of recovery from open heart surgery.
Great to hear, Doctor.
Exactly. Smaller incision is basically what we're trying to aim for in heart surgery.
Doctor, there's so many things we could talk about.
Absolutely.
But unfortunately, we're limited by time, and we'd like to thank you so much for being our guest right here on Hala Kuwait, Dr. Mohammed.
Thank you. Thank you so much for having me.
Pleasure. We were speaking to Dr. Mohammed Al-Banna, and Dr. Mohammed is a consultant cardiac surgeon at the Chest Disease Hospital. We'd like to thank him for his time with us right here on Hala Kuwait. Right now, we're going to take a short break and then be back with you with another one of our great guests. Stay tuned.